Hello, my name's Florence. Welcome to the theobspod. I'm an NHS obstetrician, hoping to share some thoughts and experiences about my working life. Perhaps you enjoy Call the Midwife, maybe birth fascinates you, or you're simply curious about what exactly an obstetrician is. You might be pregnant and preparing for birth. Perhaps you work in maternity and want to know what makes your obstetric colleagues tick, or you want some fresh ideas and inspiration. Whichever of these is the case, and for that matter, anyone else that's interested, the theobspod is for you. Episode 138, Baby's Movements. I thought, having released a few episodes with some amazing guests, that I would return today to a clinical topic. And I thought immediately about doing an episode on fetal movements or reduced fetal movements. But then I decided that a more appropriate title would be Baby's Movements, because no woman ever referred to her baby during her pregnancy as a fetus. I've mentioned in previous episodes that I used to write FMF, fetal movements felt, in people's notes. And then, having talked to some women during my work on maternity experience, I realised that this was not helpful. It was an abbreviation they didn't understand. And again, there's that fetus word there. So now, when I routinely ask women about their baby's movements, I might write baby active, or active baby, or baby a bit quiet. But in the clinical notes, people often write reduced fetal movements, or RFM for short. And this can often be an indication for induction, curtailing the pregnancy, getting the baby out, and intervention. So I was pondering this week, and I thought, right, maybe I need to take a bit of a slightly more in-depth look at baby's movements, what we're expecting of women, and what the guidance actually is. It's variable in pregnancy at what point a woman will start to feel her baby move. Traditionally, in the past, this was known as quickening, the point at which the woman felt the baby within her. I remember in my own pregnancies when that started. It's very small at first because, let's face it, the baby is very small. It can feel like a flutter. I always felt it was a bit like having a jumping bean inside me. Or sometimes women can confuse it with their tummy rumbling, gas passing through the bowel. Women usually feel something by their second scan, so that's around 20 weeks. And this is useful because after that point, they have the ability to get to know and bond with their baby a bit through the baby's movements, but also assess how the baby is doing a bit more because they can feel it moving. Some women, particularly those that have had a baby before, may recognise movements much earlier than this, possibly because they're familiar with what it feels like. Because a baby is moving pretty much from the first trimester, once it's got limbs. But we're not able to recognise and feel those movements simply because the baby at that point is so small. I remember with my second baby, I felt her move from around 14, 15 weeks. And that's definitely something I experience in the clinic when I see women. Some women will feel their baby move much earlier. second time around. With the national aim of reducing stillbirth in recent years, emphasis on a woman knowing her baby's pattern of movements has been really emphasised. And it is a very important sign. There's a definite association between reduced movements and stillbirth. If we look at the RCOG Green Top guidance on reduced fetal movements, it states that 55% of women experiencing a stillbirth perceive a reduction in fetal movements prior to diagnosis. And I think the thing about fetal movements or baby moving is very difficult because it is the woman's perception. And there's a lot of discussion about what do we mean by changes in the baby's movements and how might we expect a woman to monitor those movements. It's interesting, if you have a bit of a look at the Green Top guideline, what is considered normal in inverted commas. So it talks about the fact that most women will be aware of their baby moving by 18 to 20 weeks of pregnancy. And then it talks about a gradual increase in movements until 32 weeks, at which point the movements tend to plateau. And it talks about the fact that the average number of generalised movements per hour can be 31, with a range of 16 to 45, and the longest period between movements ranging from 50 to 75 minutes. It talks about the fact that the baby is quieter when it's asleep and that there are some diurnal changes, so across the hours of the day, and that in baby's sleep cycles, usually lasting for 20 to 40 minutes, the baby will be quiet, and that these cycles rarely exceed 90 minutes in a healthy baby. But it does then say that there's currently no universally agreed definition of reduced baby's movements. It then goes on to talk about lots of different factors that influence a woman's perception of their baby moving. In my experience, it usually depends a bit what the woman is up to in her day. If she's busy working or perhaps looking after a toddler, she's distracted, she's not focusing inward on her baby, she's much less likely to feel fetal movements during the day. And it's often when women perhaps sit down in the evening or go to bed at night that they experience and are very aware of their baby moving. The bubbling flutters that the woman may have felt in the second trimester when she started feeling movements change as the pregnancy progresses. As the baby gets bigger, the movements are obviously more robust. And it's at this point in pregnancy, beyond 28 weeks, when you can sometimes see the baby's movements if you look at the woman's abdomen. You can see the movements ripple across or bits appearing to poke out. I remember with my babies that one of the common times I felt a lot of movements or could visibly see the movements was when I was in a nice, warm, relaxing bath. It's at this point in the third trimester when the woman will probably be experiencing what feel like kicks, or the whole baby rolling, or quite often hiccups as well, a jerky, rhythmic set of movements. In recent years, there's been this kind of what I felt might be a bit of a myth about an anterior placenta, which may reduce the woman's perception of fetal movements. And I wondered where that had come from, because historically, that was never something that we were taught about or was discussed. but it is in the Green Top guideline. But importantly, it says prior to 28 weeks, there's some evidence that an anterior positioned placenta may decrease a woman's perception of her baby moving. But that's before 28 weeks, not later on in pregnancy. Of course, there are drugs that may affect the baby's movements, something that sedates the mother. Cigarette smoking may have some association with reduction in the baby's activity. And some of the medications we use for blood pressure may make a difference. And the position of the baby may make a difference, how it's lying. It may be harder for the woman to feel her baby move if the baby's spine is anterior, because the movements are happening in towards her spine. So how can we assess the baby's moving when it's completely observer dependent, subjective, and entirely up to the woman? And how can we give women guidance on what they should and shouldn't feel? We normally look at baby's movements by maternal perception alone. Sometimes if we're scanning, we can see the baby moving, and then we can tell whether the woman is feeling those movements or not in real time. Scanning has shown a correlation from 37 to 88%. That's very wide variation, but it has also shown that large body movements of the baby and those lasting more than 7 seconds are more likely to be felt. And it does definitely say that it appears women feel things more often in the evening when lying or sitting down. The duration of time in which a woman might perceive 10 movements has been used in some research. But this, again, is very variable. Some women may experience 10 movements within 20 to 30 minutes. Others may need to count to 162 minutes before they felt 10 movements. It used to be that we talked about the Cardiff count to 10. Certainly when I was pregnant with my children some 20 years ago, this idea of formally counting and that once you'd got to 10 in a day, that was okay. Or if you were worried about your baby, you should start counting, and once you reach 10, you could dismiss it, has been largely dropped. There's insufficient evidence to recommend this formal counting. And you can see why. If we're counting to 10, but actually we've said a normal baby might move up to 30 times an hour, counting to 10, there's no wonder there's no evidence for that. So we've moved much more to trying to encourage women to get to know their baby's pattern of movements. Is there a time of day when they expect their baby to move? It usually moves at this time. They're getting familiar with what their baby's behaviour is, which will be dependent on their baby's position and their baby's normal level of activity. And I've definitely had some women who've had babies before say to me, this baby is a much busier baby. It's much more active than my last baby. Or the converse, this baby's always been a bit of a quiet baby, but that's okay because I know this baby has always been like this. So we encourage women to get to know their baby's pattern of activity. And if there's a reduction or the baby stops moving after 28 weeks, then we ask them to contact us urgently. They shouldn't wait until the next day. They should come in. The Green Top guideline does talk about if there's a reduction after 28 weeks and the woman is uncertain, she can lie on her left side and focus on the baby's activity for 2 hours. And if they don't feel 10 or more movements in 2 hours, then they should come into the maternity unit. But I do worry, with all this emphasis on stillbirth and with the emphasis on knowing your baby's movements, that we do make women anxious. And certainly it does say in the Green Top guideline that asking women to monitor their baby's movements is associated with increased maternal anxiety. And we may see this with women coming repeatedly saying their baby isn't moving. And that's very difficult for us to deal with. Once we have looked at the baby's heartbeat tracing, which you can listen more about in my fetal monitoring episodes, and perhaps doing a scan to exclude any complications such as growth restriction that might be a reason for the baby moving less, then it's very difficult to reassure women if they're continually coming saying their baby isn't moving. We can't ignore that woman's feelings. Her intuition, her sense that something is wrong is very difficult, regardless of what tests we do, for us to be saying, yes, this baby is definitely okay. So what should we do when a woman comes to us and is worried about her baby's movements? So the first thing is to check what's her history, what are the other possible factors that may be increasing the chance of stillbirth for this particular woman and this particular pregnancy. As I mentioned, we then want to do a baby's heartbeat tracing if she's beyond 28 weeks to analyse and look at the well-being of that baby at that moment in time. And then the next mainstay is a scan, an ultrasound, to look at the baby's growth and the water around baby and the blood flow test to the baby to look at the baby's well-being. If we don't have immediate access to a scan, then we want to do the heartbeat monitoring, measure the fundal height, that's the height of the bump, to try and assess, is this likely to be a growth restricted baby or not? And then do an ultrasound perhaps the next day or at a later point. The difficulty we come to is what next? And I mentioned women that come recurrently saying their baby hasn't moved. So if you look at the Green Top, it says women should be reassured that 70% of pregnancies with a single episode of reduced fetal movements are uncomplicated. 70%. Okay, that's quite high. If I was told that as a woman, I would be thinking, hang on, that means 30% of pregnancies with a single episode of reduced movements are not uncomplicated. I mean, that would worry me, I think. I don't think that statistic's terribly helpful. We need to tell women that actually the formal counting kick charts are not terribly helpful. And we do need to keep encouraging women to come back to us. So we may need to recurrently perform serial growth scans if the woman is saying her baby is still not moving. And we do need to be aware that women with recurrent reduced movements of their baby do have worse outcomes. And this is why we have quite a low threshold when a woman comes saying her baby hasn't moved at full term and the scan is normal. We have quite a low threshold to suggest induction because we don't know which babies are more at risk. We don't know why the baby might not be moving. And therefore, the logical thing is if a woman is continually worried about her baby, she doesn't feel her baby's moving the way it previously was, and we haven't got an explanation for that, but everything looks okay. When the downside of induction is possibly more intervention for her, we reach a lower and lower threshold to say, let's induce, let's get this baby out. At my work, when we see someone with reduced movements, we try and think a bit about the frequency with which this event has occurred. For example, if a woman is coming with reduced movements every day or every few days, that's very different from if she came once with reduced movements at 28 weeks and then again with worries about her baby's movements at 33 weeks and then again now at 37 weeks. Those worries are very spaced apart. They're much less likely to suggest an ongoing problem, particularly if scans at those points have been normal. So we take into account when we're thinking about a reduction in the baby's movements, the duration and frequency over which these episodes have occurred. And if they are several weeks apart, to us they carry less weight. And I'm not saying we should ignore when a baby is moving less. Far from it. But I do worry sometimes that we see a lot of women where we've perhaps shaped the answer. So in our antenatal clinic, one of our standard questions is the baby moving? Is the baby active? How are the baby's movements? And if a woman is directly questioned about that, she sometimes then starts to doubt herself. And I've definitely had women say to me, I think it's moving fine. Or, yeah, I haven't noticed anything. But now you mention it, maybe it's not moving as much as it was. Or maybe there's been a bit of a change in the last few days. Because we're making a woman actively think about it. We're asking her and putting that responsibility onto her, and then she's starting to think, oh, I don't know, is my baby moving? Is it not moving? What should I say? Maybe, even though I haven't noticed anything changing, maybe there is a problem. Are they suggesting there might be a problem? What if I miss the fact there's a problem? So sometimes I see women that have been labelled as reduced fetal movements, their baby's not moving, and maybe induction's been suggested or they've had a scan, and then I'm asked to see them. And when I talk to them about their baby's movements, they say, yeah, I know that's written in my notes, but actually I wasn't worried about my baby. Or they'll say, well, it's changed a bit, but it's just the midwife asked me. And it's a difficult balance because we need women to be vigilant. We do. And I've definitely seen women come with reduced movements and it has been in the nick of time, and it's really crucial that they turned up at the hospital. And equally, I've seen women come with worries about babies' movements and it has been too late. So it's a very difficult balance to get right. I do appreciate that. But I do think we also need to think about the way we ask, rather than going in a more directive fashion. Are you happy with the baby's movements? Or is the baby moving less? To more open questions like, is the baby following its normal pattern? How's the baby doing? Is it an active baby? I don't know. I don't know what the right answer is. But I definitely see women that have been labelled recurrent reduced movements that then end up down a series of interventions that they didn't want, or restriction of choices in labour, such as not being able to have a home birth or being recommended continuous heartbeat monitoring, when perhaps we've over-medicalised and over-complicated things. So, food for thought. What's my zesty bit? I think my zesty bit is we've got to work with women on this one. We are completely reliant on them. And there's lots of really helpful advice and information leaflets and resources online for women about babies' movements. And I'm enclosing some in the programme notes. And I think you could, as professionals, use these resources to have some really good conversations with women. So we kind of come away from the binary idea of the baby's moving fine or the baby's not moving fine into a bit more of an in-depth conversation and understanding about what a woman should or shouldn't expect her baby to be doing. Some of the leaflets and information, such as the Mama Academy and Tommy's leaflets, also have information in different languages. And I do think this is really crucial, because I think when you look at the population, women that don't speak English are at an immediate disadvantage. You may be talking to them through an interpreter, and some of the subtlety of what you're trying to describe may be lost. So if we've got good resources in other languages by these charities, and you're seeing a woman just for her normal routine antenatal care who speaks one of those languages, why not draw her attention to that good quality information in her native tongue? Whether that's by printing it out or showing her online. We need to use these resources much more effectively. So my zesty bit is having a better conversation with women about their baby's movements. Trying not to increase anxiety, and using intervention judiciously, thinking for each woman that you see, is this a woman whose baby is at risk and we do need to intervene? Or have we over-medicalised and over-complicated this by making her anxious about her baby's movements? If you're a woman or partner listening to this, get to know your baby's movements, read the information that I've attached, and be confident in your baby. A baby moving inside you is one of the weirdest things I have ever experienced. I always felt like my baby was literally about to burst out through my skin, like that horrible scene in Alien when the alien kind of bursts out of her abdomen. So it is a very, very weird sensation. But equally, it's the start of getting to know your baby. And I used to, yes, put my hands on my belly, talk to my baby, get to know my baby. And the more you get to know your baby and you get confident in what your baby's like, the better you'll be able to judge things when we ask you that question. And come to your appointment clear in your mind. Are you happy with how your baby is? Or are you worried about your baby? And don't let us sow seeds of doubt or increase your anxiety. Be confident in yourself as a mother. You know your baby. You're the expert on your baby. And don't let us shake that belief. If you're worried about your baby, tell us you're worried. If you're happy with your baby, tell us you're happy. you and only you are the best judge of the well-being of your baby. I very much hope you found this episode of the theobspod interesting. If you have, it'd be fantastic if you could subscribe, rate and review on whatever platform you find your podcasts, as well as recommending the theobspod to anyone you think might find it interesting. There's also tons of episodes to explore in my back catalogue, from clinical topics, my career and journey as an obstetrician, and life in the NHS more generally. I'd like to assure women I care for that I take confidentiality very seriously and take great care not to use any patient identifiable information unless I have expressly asked the permission of the person involved on that rare occasion when it's been absolutely necessary. If you found this episode interesting and want to explore the subject a little more deeply, don't forget to take a look at the programme notes where I've attached some links. If you want to get in touch to suggest topics for future episodes, you can find me at theobspod on Twitter and Instagram, and you can email me theobspod@gmail.com. Thank you for listening.